early is early enough? What age?
As soon as it's discovered. Usually this condition tends to present in the infancy, in the first year of life. You know, the conditions that produce cerebral palsy can happen in utero or around the birth, or shortly after birth. The assault to the brain can happen any of those periods. But in Nigeria, the commonest causes are birth asphyxia or neonatal jaundice.
So that means that the condition should be discovered
sure.
within 6 months?
Or even, yes, of course. Within 6 months, it starts presenting. As soon as the child is, the first 4 years of life, you see the presentations. So once you discover it, the child is taken for evaluation, and therapy is started immediately. Okay,
so if a 6-month-old child is brought with such a problem,
yes.
therapy can be started.
Yes.
How do you factor growth? You know, we're talking about children,
yes.
and they're going to grow.
Yes.
And then they have some of these interventions where they correct a muscle, a tendon, or they fix something into the body. How do you plan for growth of the child? The limbs getting longer, or is that why some of them have shorter limbs?
Oh, definitely.
Later on in life?
There's no doubt about it. I'm not saying the fact that certainly growth to be affected one way or the other. That is already recognized. But you know, the focus, like I said, is not necessarily about growth or no growth, but to make sure the child is independent, because that is key and that's paramount. So definitely there will be some deficiencies here and there with regards to growth. But if the child is functional, can take care of himself, can go to school, then the aim will have been achieved.
I know that as a plastic surgeon, one of your areas of focus would be cleft palate, yes. cleft lip.
Yes.
How much of that would you say we see in Nigeria?
Well, we see quite a few. Because I work in a referral center, the National Medical Hospital, we see quite a lot that are referred from the periphery. So I would say it's still a significant health burden, even though a lot is being done to clear these cases. Courtesy of Smile Train, it's a non-governmental organization from the United States that's assisting in funding the care for these children. So a lot is being done. We look for them wherever we can find them. We refer them to orthopedic. They are referred to orthopedic, where we put on them free of charge because it's already been paid for by a Smile Train. You understand? So yes, it's a burden, but we are up to it.
Okay, let me go to, you know, before a child like this is even born. Is there something that can be done to reduce the burden, you know, before surgery, that is before birth? Is there something a pregnant woman can do, a mother, a family can do, maybe some sort of supplement during pregnancy, so that a child doesn't come with cleft lip or palate?
Right. Unfortunately, what we should be saying is there something are there things they should not do?
Oh,
that should be the question, because every woman that is pregnant is advised not to do certain things because there are risk factors that produce congenital anomalies. It doesn't matter what kind of anomaly it is. The risk factors are the same. For instance, a woman being exposed to drugs without prescription in the first trimester of pregnancy, first 3 months of pregnancy, a woman being exposed to radiation, a woman contracting certain infections. Okay, so these are some of the conditions that are regarded as risk factors, and they produce congenital anomalies, and we can't tell what kind of anomalies that we produced. So cleft lip and palate, we can't say that this is what causes it specifically.
Okay.
And some of them, women don't even have all those things, and they just come. They're just accidents in development that are
even without all those risk factors being present.
In fact, the large majority of them are normal women with normal pregnancy, normal care, and yet they come down.
So just a freak of nature.
Accidents of development.
But coming to one of those risk factors you spoke about, radiation. Yes. Apart from X-rays, where would somebody contact radiation?
Well, X-rays basically, overexposure to X-rays. Yes, you can. And if a woman is going to have radiotherapy, for instance, and she's pregnant, I'm sure the radiotherapist will not want to irradiate her when she's in the first trimester of pregnancy. So, but most times it's from X-rays, the regular X-rays.
So let's talk about the special challenges of children with cleft lip and palate. What would they be? Well,
the children with cleft palate especially, well, the children with cleft lip, the basic problem is cosmetic. Okay. Just cosmetic. So the psychological problem with the parents and all that.
Definitely. You wouldn't want to be walking out on the road with a split lip, you know, and everybody asking what's wrong with that child.
Yes, yes. So getting taunted at school and all that. So that's the problem with that. But cleft palate is a different entity entirely.
That one is not usually seen, is it?
No, it's inside. It's a hole in the roof of the mouth that makes the mouth communicate with the nose. So the child is unable to create a negative suction that you need, a negative pressure you need in the mouth to suck. So the child will have feeding problems because the child cannot create suction, negative pressure that is required for suction. So there are feeding problems, there are speech problems.
Because the sounds don't come out well.
Exactly. Once there's a hole, you need all those, you need a tight space, tidy closed space to make the necessary sounds.
Do they have problems of food coming out of the nose?
Yes, they leak fluids and food through the nose because of the hole that communicates between the mouth and the nose. This shouldn't happen ordinarily. But because of that hole,
yes. I imagine there will be implications for infection with that.
Oh, definitely. They have recurrent ear infection from those food leaking here and there. They have recurrent ear infection. They have recurrent chest infections. Okay. They also have problems with the teeth, dental anarchy. The teeth are disorganized. These are some of the things you find.
That brings even the dental surgeon into play again at the end of the day.
Yes, it's multidisciplinary. So orthodontists are called in at a certain point in time.
Okay. So you have mentioned a lot of things.
And then,
now.
Sorry, I forgot to mention speech therapy.
Okay.
Speech is actually the most important concern of the surgeon because, the children will not be able to speak well except you repair the cleft palate and refer them to speech pathologists.
Okay. So that kind of child probably will start speaking a lot later than a normal child, right?
Well, we start speaking about the same time, but we have a corrupt speech. That's all.
What if the child is brought right after birth? You answer this question when we come back from the break.
Okay.
We're going for a short break now, and we'll be back soon, shortly after this. Stay with us.
Okay.